our cold therapy devices that we carry, we actually stock two different units. We have the Bragg Kodiak unit. This is specifically used for our hip patients because it comes with a special pad for the hip to cover the best surface area. Then we have the DonJoy Iceman. This is used for all of our total knee procedures, any of our shoulder procedures. Comes with a universal size pad and accommodates and fits all patients with an extra wrap in there. As far as tips for using the ice machine, everything is actually listed on the lid for the DonJoy Clear. Basically, you're going to fill the unit with ice first, top it off with water, attach the top, attach the pad and the hose, and then plug it in. Once you plug it in, it will actually start to circulate water through the cold pad. These devices, both of them will stay cold up to 7 hours at a time. After that, when the unit starts to cool off a little bit, you can top it off with ice. The AC adapter to plug it in is usually in the unit itself. It actually plugs into the back right here. Okay. These are not covered by insurance, highly recommended for all of our total joint procedures, and we do a discount of $250 for our self-pay patients. Okay. The Kodiak unit does have the instructions on the side, but it's basically the same. You'll fill it with ice, top it off with water, attach the pad, plug it in, and then it'll start to circulate. We do tell patients, one quick tip, people have asked if they can put frozen water bottles inside the unit to help keep the devices colder longer. That's okay, but the manufacturer wants us to make sure we tell people there can't be any paper or glue on the bottles, the water bottles themselves, because then they'll get trapped in the motor and then the device won't work efficiently. So if patients do ask about that, it's not something the manufacturer will recommend, but if they get all the glue and paper off, it is something that patients will do. So again, these are non-covered by insurance, highly recommended to help with post-operative pain and swelling. Also for patients who have trouble with medications after surgery, this is a great alternative. So $250. Okay.
Is there a chance of burning the patient with this? An ice burn?
So we do typically recommend that there is a light barrier between the patient and the pad. That can be a t-shirt, a pillowcase, but something light. These units are supposed to not go lower than 54 degrees, so they should not get frostbite, but it is something that we like to educate patients on, to put that barrier underneath. We also recommend post-operatively, patients are usually using this an hour on, an hour off, and then not to sleep through the night. They can doze off during the day, but not to fall asleep through the night with the device on. Okay. One other thing to mention, we do tell patients to keep it level with the bed. It's less stress on the motor if they put it on the floor where the motor, and then up on the bed, just that distance. So if you can keep it level with the bed, that helps prolong the life of the units.